It's not the test, but the chapter itself. In chapter 7, anatomy and physiology and medical terminology. Again, you guys have dealt with a lot of the anatomy and physiology, I mean, the medical terminology. And when we took the EMR course, we went over anatomy and physiology. It's about the same thing. And key things that you need to remember that the term anatomy deals with the structures and physiology deals with what they do. Medical terminology is how to actually describe them, whether there's something wrong, whether there's something right. Now, we do actually still have to go over pathology, which is what we live for. We don't, most of us don't like to deal with patients that have nothing wrong with them. We have to want to deal with something that's wrong with the patient. So, okay, knowledge of the human body is required to assess and care for patients. Again, you're dealing with the structures where they're located at, like the blood vessels, different cavities in the human body and different organs in the human body. Now, you also have to realize that we have to know what they actually do. And when they don't do what they're supposed to do, then we start dealing more with the medical aspect of anatomy and physiology. Okay, physiology refers to the body, how it works, and anatomy refers to the way the body is made. Medical terminology allows the concise communication to other personnel about what can actually be going right or wrong with the body. Anatomical positions. Now, we went over this some time ago, and this is how you basically find the patient or position the patient, or what to describe on what the body, the body positions are. The standing facing forward is the anatomical position. Arms to the sides and palms forward. So basically, the palms are going to be facing forward, and basically you're standing straight with the arms stretched and the legs slightly apart. Okay, positions in the body. Positions of the body, not in the body. Positions of the body. You have supine. Remember what supine means?
Laying down flat on your back.
Yeah, laying down flat on your back. Prone is laying down on your belly. Lateral recumbent could either be to the left side or right side. Fowler's position. Oh, what is Fowler's position?
At a 90-degree angle.
45. Well, actually, no, you're right. 90-degree angle. Semi-Fowlers will be at a 45-degree angle. Okay, so 90-degree angle. And I'm going to tell you something. Try to carry somebody in a 90-degree angle. It's going to be very uncomfortable for them. Semi-Fowlers is more of a comfortable position. And Trendelenburg's, what is Trendelenburg position at? What does the Trendelenburg position look like?
Feet elevated.
Feet elevated. Now, there's a difference between the shock position and the Trendelenburg's position. In the Trendelenburg's, the whole body is straight. You elevate the legs. It's like you have them on a backboard, you elevate the legs, and the body is straight. In the shock position, excuse me, you're basically bending them at the hips. And you elevate the legs at the hip section. So what is this? Without you looking at this.
Supine.
What you say?
Supine.
Okay, you said supine, man. Supine. It's a pine. Yeah, you're right. This would be the prone position. This is the right lateral recumbent. And of course, if they were facing the opposite way, it would be the left lateral recumbent. What's very important about the left lateral recumbent position? Who do we normally put the left lateral recumbent position? Who do we put? Sorry?
Unconscious patients.
Unconscious? No, it could be on the right side or left side, but when it comes to the left side, pregnancy in the 3rd trimester.
Oh.
Left lateral recumbent with a chancla off. This is a Fowler's position, which I think this is not really a Fowler's position. This is not a 90-degree angle. This is like maybe a 45 to 60-degree angle. This would be the shock position. Remember, with a shock position, you elevate the legs, but they're bent at the hip area. And when we're dealing with the other one, with the Trendelenburgs, it's like actually having them on a backboard and the whole body is straight. Now, we also have to deal with the planes, anatomical planes, which is basically an imaginary line that you draw on the patient so you can actually be able to describe where an injury could be located at, or where an organ system could be located at, or something could be located at. So we have sagittal and mid-sagittal planes, frontal and coronal planes, transverse or horizontal planes, midline itself, mid-axillary line, and a transverse plane. We'll go over these. Now, if you notice, these are the lines that you actually kind of draw. So when we're dealing with the frontal plane or the coronal plane, you're basically dividing the body into front and back. When we're dealing with the sagittal plane, you're dividing them into right and left. And when we're dealing with the transverse planes, you're basically dividing them from the up and down, superior or inferior. Now, there's sagittal and there's mid-sagittal, which basically go a little bit further this way, away from the midline itself. Terms of direction, of course, to the top would be superior, to the bottom would be inferior, to the front would be anterior, and to the back would be posterior. Now, we also have a couple of different terms when we're dealing with the front and back. We have dorsal, which basically means what?
The side or the back.
The back. What would you describe the front? Dorsal and?
I don't remember.
Oh, we'll go over it, don't worry. I
Uh,
just forgot right now. It would be dorsal, and I know it's anterior. And I remember because I took a class called ichthyology, which is basically the study of fish, or and they have dorsal fins, and they also have ventral, ventral, ventral is towards the front. And that's how I remember it, by remembering what I learned from fish. So then we have the regions of the body. We have the head region. Now we're dealing with patient assessment. This is how we're going to break it down. The head region, then we have the neck or the cervical area. Then we have the thorax, okay, which basically the thorax is the whole thing. And the thorax is divided into the lung area, and of course the abdominal area. You have the hips, inguinals, because the inguinal arteries and inguinal veins and ligaments are going through there. They have of course, the genital region, which is basically the reproductive section. And then, of course, we have the bottom, or the dorsal, or the foot, which basically the dorsum is towards the top, and the plantar is towards the bottom. Okay, so of course we have the lower extremities, upper extremities, which is the arms and legs, and we're gonna have to memorize the bones and everything, so we can actually better describe the type of injuries that we're going to be dealing with when we deal with trauma, because EMS loves trauma. Okay, this is a little bit more breaking out and describing the anterior chest. If you look at it this way, this is more of a topographic, and the word topographic means regions. So I know because we dealt with them when we're dealing with surgical class. We dealt with regions. Okay, what's located in the right shoulder? So we start talking about, okay, the right shoulder. Would you have your manubrium itself? No, not the manubrium. Sorry, we have the not the angle of Lewis. I'm sorry, the
collarbone.
yeah, the collarbone, also known as the clavicle. And then we have the acromion process, and then we have your scapula. So we deal with those three bones, and of course all the muscles that are attached to those. Like if you're gonna do shoulder surgery, that's what you concentrate on. Then of course you're dealing with the xiphoid process. We're dealing with not the xiphoid process, but we're dealing with the sternum itself. It's connected to the xiphoid process and the manubrium. Okay, and those are connected to the clavicles. And each rib is connected, but not physically through bone, but through cartilage. It's an articulating cartilage. And the same thing in the back, we have the scapula, the back bones. We remember the first 7 are considered the cervical bones. Do you guys remember what the first and second ones are called?
First and second, what?
Cervicals. I'm going to give you a hint. The first one is the axis. The second one starts with an A also. It's also known as the atlas. Okay. I think those are the right way. So anyway, then we have C3, C4, all the way to C7. And then from there, we deal with the lumbar. And when you're looking at these bones, they actually do change. I mean, they get larger the further you go down, but they actually change slightly in structure. So that's why the cervical bones in the neck are different from the thoracic bones. All the thoracic bones have the a process cartilage. Well, it's not cartilaginous. It's a process that's actually connecting to every single rib. Okay, I know because I've dealt with patients that have actually dislocated this portion of it. Like, have you ever been stretching, all of a sudden you feel a pop in your chest?
Yeah.
A slight dislocation of these articulating joints right there. Okay, so then we deal with the side view or the lateral view, which basically mid-axillary goes straight down the axis where your axilla, then posterior axillary line and anterior axillary line. Okay, and the middle one, which is your axillary line, is a mid-axillary line. And we describe different injuries to those. Like if you got stabbed right around this region, it's between the posterior and the mid-axillary line. And then you have to remember which rib it is. So if you're talking about this point right here, talking about maybe this point right here, around the first, second, third, fourth, fifth, maybe the fifth and sixth rib. Topographic anatomy again. We start dealing with different aspects. So we're dealing with patient assessment. We're going to go over those a little bit more specific on what we're looking for. Like in the face, the head region is divided into the frontal and posterior, or the frontal and the back. And basically, the frontal is the facial bones, and the posterior is your cranium, which we're dealing with the parietals, the occipital, and all these, the temporals and everything, even the frontal bone, which the frontal bone is part of the anterior portion. But when we're dealing with the frontal bone, I mean the facial area, we deal with the frontal, which basically makes the upper orbits of what do you call it, the eye sockets, and the eye orbits itself, where the eyeballs are at. The maxilla, which is a non-movable joint, and the mandible, which is a movable joint. Of course, you have the sternum and still everything else. When we're dealing with what do you call it? Breaking it down, you have to remember what bones are located. Remember, the humerus is right here. Then you have your radial, and then you have your ulnar bone. And the radial and ulnar, remember that the radius always goes towards the side of the thumb, while the ulnar goes the opposite way. Okay. Now we start dealing with the organ systems itself, and we start dealing with the esophagus. Anterior to the esophagus is the windpipe, which basically consists of the trachea and the section of the voice box and so whatsoever. Then we start dealing with the lungs and how they actually separate into the bronchus, separate into right and left, with the middle being the carina. Okay, then of course you have your spleen on your right side. I'm sorry, on your left side, and then you have your liver on the right side and partially on the left side. The pancreas itself is right below right above the stomach, close to where the liver is at, but it's the division is anterior and posterior. So when the body is forming, part of the pancreas goes towards the back of the body, and part of the pancreas, the other part of the pancreas is to the anterior portion of the body. So there's a cavity in between those two. Remember, your kidneys are towards the back, in the back cavity, also known as the retroperitoneal cavity. And the body is divided, like with everything, like all houses, cars, was made by into compartments. So you have the cranial compartment right here, the cavity, the thoracic where the lungs and heart are, and the blood vessels, major blood vessels. And you have your abdominal where all your most of the digestive organs are at. And then you have your pelvic, which is where most of your reproductive and part of the urinary system is located. Remember, the spinal cavity itself also is where your spinal cord actually goes through in between. So that's what's kind of important to protect C-spine, because if for whatever reason you have an injury to one of these areas, you can actually sever this off, and whatever the brain is telling the body to do below that section, it won't do it. We divide the body into 4 quadrants, specifically in the abdomen. And the abdominal cavity basically deals with the right upper quadrant, left upper quadrant, right lower quadrant, and left lower quadrant. And so we start talking about what organs are behind that. And this is a really good depiction of what's located out there, because I mean, part of your patient assessment, you're going to have to palpate. You're going to have to press down on those regions and look for DCAP-BTLS. Remember what DCAP-BTLS stands for, guys? Deformities, evisceration, contusions, actually not eviscerations, deformities, contusions, abrasions, punctures, penetrations, burns, tenderness, lacerations, and S, which is swelling. So basically, the large intestine is in all 4 quadrants. Small intestine is in all 4 quadrants. The liver should be mainly on the right upper quadrant, and part in the left upper quadrant. Your spleen is in the left upper quadrant. The pancreas itself is on both quadrants, right and the right upper quadrants. And then, of course, small intestines, of course, your kidneys are retroperitoneal, but you can also consider them being part of those quadrants. The skeletal system, a bony framework, basically made of ligaments and tendons. Remember, ligaments hold bones together, and the tendons hold bones to muscles. So part of the muscle itself is a tendon, where it's connected to the bone, and the ligaments is where the bones, like the wrist bones, they're surrounded by ligaments, which basically keeps them in one place. And the connection between bones are made by ligaments. Muscles and I'm sorry, you have a bony framework. You also have muscles and connective tissue. The connective tissue would be your, believe it or not, the capsules that are in between your bones, like the your knuckles themselves have a little capsule, and you find out that you have a capsule once you hurt it, and it swells up. You can barely move it. Your knee, I don't know if you guys ever gotten a knee injury. Sometimes it fills up with fluid, and that fluid is basically fluid that's being drained into that cavity itself, which is that capsule. The functions, it provides shape and protects the organs, which is the skeletal system. It allows for movement, which is the skeleton and the muscles and tendons. And you also have storage purposes. Now, what does it store? Bad intentions. What do the bones store?
Bone marrow.
Well, bone marrow is part of the bone, but how about calcium? I don't, because when somebody starts not able to store calcium, you start going through osteoporosis. So one of the main elements, I mean, or chemicals, why can't be elements? will be calcium. Okay, the skeletal system, 6 basic components of the skeleton. You have the skull, spinal cord, thorax, pelvis, and upper extremities and lower extremities. And basically, this is the anatomical picture of what they are. You have the skull. Of course, you have all the bones of the skull itself. You have the cervical collar, or the cervical section of the vertebrae. Then you have the thoracic section where the ribs are located at. And then after the last rib, you have the lumbar. And then you have your sacral. And then your coccygeal area, which basically is your, I guess, vestigial monkey tail. Then you have the lower extremities and you have the upper extremities, which is the lower extremity would be the femur, tibia, fibula. Then you tarsals, metatarsals, and phalanges. And then you're dealing with the upper extremities, which consists of the humerus, radius and ulna, carpals, metacarpals, and phalanges. The skull itself, as remember, is divided into frontal and back section. The back section is you have the parietal bones, which basically cover the parietal portion of the brain. The temporal section, which is right in back of your eye socket. Your frontal bone, which is basically would, with the frontal portion of your skull. Your occipital bone, which is the back portion of your skull, where the eyesight and other part of the brain, the occipital region of the brain is located at. Okay, you have your mastoid and hyaloid process right here. I'm sorry, mastoid and styloid process. The hyaloid is a bone that goes around here that's not connected to any other bone, but it's connected to the tongue. You have your maxilla, and of course the movable joint at the bottom called the mandible. Of course, you have the orbital bones, which is made out of the zygomatic bone, the nasal bones, ethmoid. You also have the sphenoid bone, the back portion of this. I have better pictures of them later on. Then, of course, you have your cervical portion, which is your cervical area, which is a 7 cervical vertebrae. Then you have 12 thoracic vertebrae. You have 5 lumbar vertebrae. And then you have the sacrum and your coccyx, or the coccygeal area right here. And depends on how close you are related to monkeys, you might have an extra one. I was asked a question today, really weird question. Let's see if you guys can guess what it is. What is blue and not that heavy?
Light blue.
Oh man, how did you know?
He's a whiz.
It's light blue. Duh. And of course, I told my kids, and they were looking at me like, sky? I said, no. Somebody's been paying attention. I never said this one before, but so anyway, and note this: there's inward curvatures. There's 2 of them at the cervical region and at the lumbar region, and 2 outwards, which is your thoracic and your coccyx. Not the coccyx. I'm sorry, the sacrum. And the spinal cord goes all the way through there. There's a whole right and back of the skull. It's called the foramen magnum. Then you have of course, you have the sternum, and the sternum is broken down into 3 sections, which is going to be the sternum itself, the manubrium, and then you're going to have your xiphoid process. I think that we mentioned most of these is lumbar, then the humerus is the upper bone, and then you have the ulna and radius. Then you have your pelvis, which is you have your ischiums themselves, or the iliums themselves, which is your elephant ears. You have your ischiums, which is basically your binoculars down over here. And then you have your acetabulum, which is where the head of the femur goes into your hip joint. Of course, you have your femur, and then of course the lower ones, which basically your tibia, fibula, tarsals, metatarsals, and phalanges. And how do you remember which is tarsals and which is carpals? Well, when you go to the beach and you step on tar, you step on tar with your tarsals. But when you're driving your car, you drive with your carpals. Would y'all remember that one? Because I told it to you last year.
I remember it from last class.
Okay, good. And yeah, of course, you have your upper extremities. I think, and at this point, dealing with the ribs, the humerus. I think we went over this one before. And then you have the skeletal system joints. So you have immovable joints called sutures, and I mean they become completely movable when you become an adult, but they're flexible when you're growing as a kid. Then you have your slightly mobile, which is basically your backbones, and their what do you call it? What do I want to call it? The spongiosum. It's your discs. I'm sorry. Then you have your freely maneuverable. This is one of the most freer ones, which is basically your acetabulum and the head of the femur. Joint motions, you have flexion, extension, abduction, and adduction, circumduction, and pronation and supination. The types of joints that we have, you have your ball and socket joints, hinge joints, pivot joints, gliding joints, saddle joints, and condyloid joints. And remember we talked about where your ribs are connected to your sternum and your back. These are condyloid type of joints. So remember, I also told you about the capsule that usually forms around. The capsule has this articulating cartilage at the end of each bone, and you actually have some fluid in there. Okay, and the fluid in there basically is serous synovial fluid. I'm sorry, and it's like an oil between the two, so it doesn't waste away. So then we're showing here again the ball and socket joint. You have the condyloid joint. You actually have the gliding joint itself. You have the hinge joint, the pivoting joint, like between the first two vertebrae, and the saddle joint, which is where your ankle is located at. You have the tibia and fibula, and they're basically sitting on top of the calcaneus, like if it was riding a horse. That's why it's called the saddle joint. Bone injury. Bone is living tissue and very rich in blood supply. Fractures can actually lead to bleeding from bone or surrounding tissues. And this is where we talk about the bone marrow. Towards the very distal portions of the bone, like at this portion right here, the top and the bottom, we have yellow bone marrow. But in between, you have red bone marrow, also known as what we like to call the tuétano, which whenever we're eating soup, you get a round bone, you suck out the middle, you're actually eating bone marrow. There's a lot of blood vessels in there also. Now, long bones and flat bones, actually one of the main producers of blood. Get through a process called erythropoiesis, whereby a chemical called erythropoietin that's released by the kidneys themselves. And why the kidneys? Why are the kidneys involved with with blood production?
Our kidneys filter blood.
Oxygen.
Well, the kidneys themselves, remember, a lot of the toxins are actually filtered out through the kidneys. So the kidney has two little devices within the blood vessels that will tell the brain the amount of pressure that's going in to the kidney itself and the amount of pressure is going out. So it regulates on how much water is going to release or how much salt is going to release or retain. The key thing is that if it starts noticing that there's not enough coming in, it'll signal the brain and send off a chemical that will go through the bloodstream directly to the bone marrow to produce more red blood cells. So the kidneys are very important, even though nobody really gives a shit about them until you're missing one or you need dialysis. The muscular system, the muscles allow the movement of contraction in response to nerve impulses. You have three types of muscles: skeletal, which are the ones that are connected to the skeletal system; smooth, which is basically around blood vessels, what do you call it? Tubes like the esophagus, the bronchioles, and everything. And of course, you have cardiac, which is basically located in blood vessels and the heart. And there's a difference between all three. You know, the skeletal has striations to them, like little lines. Smooth muscles don't have, and the cardiac muscles have both. I should have a picture of what they actually look like. But these are the major muscle groups that we need to remember. And if you work out, you at least know your arm ones and your leg ones. And of course, if you've taken any type of anatomy before, you gotta remember your gluteus maximus, your nalga bone. But there's a whole bunch of other ones also. You have the pectoralis. You have the sternocleidomastoid, which goes from right here, which is the mastoid process to the sternum, to the clavicle to the sternum. Sternal mastoid bone. Bone, muscle. Jeez. And so forth and so forth and so forth. But these are like the difference between the three. If you look at this one, the skeletal muscles, this is not really a good depiction of it, but you're gonna notice nuclei and those striations that go across. But cardiac muscles have the striations and nuclei, and smooth muscles, you can actually don't have the striations, just the nuclei. The respiratory system, which basically deals with breathing. Now remember, when it comes to breathing, there's two ways you're gonna get oxygen exchange. One of them is a mechanical way, where your diaphragm and your intercostal muscles and all these accessory muscles actually causes the chest to actually barrel out, I'm sorry, I'm doing it down over here where you can see. They barrel out, which causes air to go in by producing negative pressure. So respiratory system functions: respiration and ventilation. Ventilation is the mechanical portion of it, and respiration is the chemical portion of it. So again, respiration will be where carbon dioxide changes with oxygen in your cells and your tissues. And ventilation will be the way air from the outside gets in. Oxygenation and blood and removal of carbon dioxide also, and assist in the buffering of acid-base balance in the body, which basically deals with the acid-base balance, deals with your pH system and how much oxygen you're going to be combining with the hydronium ions, or hydrogens with the hydronium ions, I'm sorry. So respiratory system deals with the facial area where you have your nasopharynx, your oropharynx. Well, the nasal cavity, oral cavity, and the back portion here is the pharynx. So right here is the oral cavity. Right at the back is called the oropharynx. The nasopharynx. Right here you have your oral cavity, and right back over here is your oropharynx. And of course you have your pharynx, and then anteriorly it goes to your trachea. And the trachea is just a long tube that has C rings, cartilage mate rings. And the first two is your thyroid and your the thyroid. Oh, I forgot the name of the other one. Jeez, it's been a long day. Thyroid is where your thyroid gland is located at, and then you have your bottom one, which I forgot what it's called. I'll remember in just a little bit. And right in between, it's called a carina right here, where it separates into two. Of course, you have your lungs, your bronchioles, and your upper and lower cavities. The respiratory system structures, airway. The airway is divided into upper and lower respiratory system. At the cricoid, there you go. The cricoid is the other bone ring and the lower portion of the larynx. So if you think about it, It's located right around here where you have your cricoid. You can't really see it right that good right here, but if you look at this picture right here, it's right here in between is where you have the upper and lower respiratory systems. And we deal with it when we're dealing with upper respiratory infections and lower respiratory infections. Anything is below the cricoid is considered lower or the lungs. Anything above that is your nasal cavity, your oral cavity, and whatsoever. The respiratory structures, airway. The airway is divided into upper and lower portions, divided into by the cricoid ring and the lower portion of the larynx. Respiratory system structures. You have the airway, you have nose and mouth, the pharynx, nasal pharynx, oral pharynx, and laryngeal pharynx. We went over just a little bit ago. Okay, so you have structures of the airway. You have the larynx, also known as your voice box, the trachea itself, which is the tube that goes down after the larynx to the lungs that separates into right and left bronchi. And then those bronchi eventually become bronchioles. And then at the very tip of the bronchioles, you're going to have the alveoli. The lungs and the diaphragm. The diaphragm itself is a flat muscle, which I don't know if I have a picture of it. It's a flat muscle is located right here. Okay. And when that one contracts, it pushes down. Or am I in the lungs? Organs of respiration. You have contains thousands of microscopic alveoli. They're covered by pleural ring or linings. And is you have diaphragmatic muscles themselves that would cause air to actually go in. So we start dealing with right here, if you notice, you have your nasal cavity, nasal pharynx, oral cavity, oral pharynx. Okay, and then you have your area right here, which is where your epiglottis is at, right at the opening of the trachea. And then eventually you have the cricoid and thyroid, or thyroid and cricoid, I'm sorry. And then you have your C rings right here that form the trachea itself, right and left, primary bronchioles, secondary bronchioles, tertiary bronchioles, and eventually when we start getting to the alveoli is where you have the most distal portion of it. Now, the key thing about the airway, it's made out of all these little tubes that can actually constrict and dilate. This would be a normal size one, but let's see if you become allergic to something, it starts constricting. And within this region right here, within this muscle region right here, in the blood, in the airway muscle, there's little cells called goblet cells. Do you guys remember what the goblet cells do? The goblet cells look like a goblet. I don't even know what a goblet looks like, but it looks like a little cup. Okay. And what happens is when that muscle contracts, goblet cells produce mucus. So if you get infected and gets irritated and it actually closes up a little bit, it starts releasing a whole bunch of mucus inside the lumen of the airway. Okay, and when they dilate, when you give medications like albuterol, they dilate this big. Okay, remember your right side and left side chest. Somebody just kept snapping in my door. Snapping, yeah. So anyway, you have 2 lobes and 3 lobes. Okay, so on your right side, you have 3 lobes, upper, middle, and lower. And on the left side, you have 2 lobes, which is upper and lower. And because the heart's located and taking up some space, the lobes are a lot bigger than the other side. In between the cavity itself, which is this is the chest cavity and the lung cavity, we have what we call the pleural space. Hence the word pleura. Parietal pleura covers the cavity, and visceral pleura covers the organ itself. Visceral means organ. So the visceral pleura covers that. And within that little space here, you have some type of fluid called serous fluid that will actually lubricate and cause the lungs not to waste away whenever you take a breath in or breath out. Now, how many breaths per minute do you normally take?
Like what's average or what's normal?
Isn't 2 normal?
What is considered normal?
2?
2 respirations per minute? That you're dead.
Like 16.
It's got 2 in it, but there's another number in front of it.
To
12.
4?
12 to 20.
Oh, wow.
12 to
Well, imagine now, if you know that you're breathing, let's say 20 breaths per minute. Okay. How many do you do in an hour?
20 times 60. It's 120.
Okay. In an hour?
Yeah.
Okay. Now how many do you do in 24 hours? Everybody's phone has a calculator. It's not just for TikTok. So on and so on and so on. So you go now. You got to remember, since you first were let out the
800.
vaginal opening and you were born, you've been breathing. Okay, so that means that this engine, this respiratory engine, has been running since the day you were born. Now, let's see, you guys are like what, 25?
Nah, 22.
Oh,
21.
God, pollito. So let's say you're 20. Sorry, you're 22. Your respiratory engine has been doing all this breathing. Have you ever, now think about it, for 22 years? Now let's say you got a car the day you were born, and you crank it open and you leave it open. How long do you think the engine's gonna last? Now, theoretically, it will last forever if you change the oil and you put gas, right?
Yeah.
Okay. Well, imagine not being able to change the oil. So there's oil in between this, which is a serous fluid, what causes the lungs to actually rub against the
Rib cage.
cavity itself, and it doesn't waste away. Okay. The heart has the same thing. Now, this is the picture I was showing you with the bronchioles, and you know, if it gets dilated, I mean, constricted, it produces mucus because you have all these little cells called goblet cells around this region. Okay. Now, why do you think smokers cough a lot?
Uh,
Their
Yeah.
lung capacity shortens.
does the
Yeah.
bronchioles to contract?
Well, and you want me to tell you, you want me to tell you why? The truth of it. The chemicals in the well, before that, there's all these little hairs in all the inside the lining called cilia. And these are constantly moving mucus out of the lungs and debris out and whatsoever, right? But a smoker, the smoke itself paralyzes the cilia. So you have an accumulation of mucus. So as soon as they wake up in the morning, they start like, all of a sudden they spit something out, green or black.
Green.
And because they smoke, they paralyze the cilia. So these things, I mean, you got to realize all that stuff that's inside here is mucus, and it's covered by that lining. Now, if for whatever reason it's not being moved, it starts accumulating. Okay, you're still collecting debris and everything, but it's not being pushed out of the lungs. So once that, it starts doing it, once the lung starts sensing that, hey, we got too much mucus, it'll try coughing, it will cough it out in big chunks. Okay. So the respiratory system, anatomy of infants and children. Infants are not smaller airways. Basically, it's just that the airway is different, made differently. The adult is straight, while the child's, it's like more like a siphon. I don't know if you guys know what a siphon is, but have you all tried putting oil in your car? And when you're putting oil in your car, you have to use what we call an embudo, which is basically something like this.
The funnel.
The funnel itself, yeah. I can never remember the damn word. Well, and the kids, the airway looks more like a funnel. So if they eat a piece of something, it's easier to get stuck. And adults is basically straight. So it's very hard to get stuff stuck in there. I mean, you could still do it, but it's very hard to do it. Okay, respiratory system, you have mechanics and ventilation, you have inhalation and exhalation. Inhalation is where air goes in, exhalation when it goes out. You have the diaphragm and the intercostal muscles that react to the body. And when they react to the body, when they actually contract, they actually cause the chest cavity to expand itself. Now remember, in between the parietal pleura, which is the one that goes around the cavity, and the visceral pleura, which is the one that goes around the organ, there's like a negative pressure causing the lungs to actually be expanded to the wall. So if I get a knife and just stab you right there, you're gonna get a little bit of air in, and the lungs will actually collapse, because the lungs, all they are is sponges. They don't expand by themselves. Physiology of respirations. We start dealing with oxygen and carbon dioxide exchange in the alveoli, and they also have carbon dioxide and oxygen exchange in the peripheral capillary beds, which deals with the tissues and organs. And normally you breathe in oxygen, which goes inside the tracheal tube, and it gets housed right here. Okay, and like with everything else, when it comes to a gas exchange, we have a process where the body will change the gas or something from an area of high concentration to an area of low concentration. Now, what that basically states is that you have high concentrations of oxygen right here and low concentration in the blood vessel. So an area of high concentration of O2 will go to an area of low concentration of O2. And at the same time, an area of low concentration or CO2 will go to an area of low concentration of CO2. So it goes from a high concentration to a low concentration, and a high concentration to a low concentration, both at the same time. And that's how oxygenation occurs. This could be a picture of what we call the bronchial itself in the tissue, or let's say a tissue, like a muscle tissue, and the capillaries around it. And this is another depiction of it. You have carbon dioxide exchanging, you have CO2 in high concentrations inside the blood vessel, and they move out. I'm saying, sorry, I'm the opposite one. In the blue side, which basically means deoxygenated, you have high concentration of CO2, which basically tends to go into the capillary itself, and then you have O2 concentration and right here causing it to go back. So, and it basically is a constant exchange. I think I just confused myself. Okay, adequate and inadequate breathing. Adequate is defined as an adequate tidal volume and respiratory rate. Adequate respiratory rate in adults is 12 to 20, and elderly is 12 to 22. In children is 18 to 37, and in infants is 30 to 60. The smaller the container, the faster it's going to breathe, or the smaller the body. Excuse me. Adequate and inadequate breathing. Adequate breathing, you have regular rhythm, which is a regular rhythm again. Effortless, chest expands adequately, and there's no abnormal sounds, and there's no use of accessory muscles themselves. Adequate breathing, the rate is too fast or too slow. Inadequate, irregular rhythm, diminished or absent breath sounds, and that basically means a lung collapse. Unequal or inadequate chest expansion, pale or blue skin, or mucous membranes, and agonal breathing. Agonal basically means very slow breathing. Of course, the circulatory system, you have a closed system to transport blood, nutrients, and oxygen to all tissues, so tissues of the body itself. So it removes waste products from the tissues and it gets rid of them through the respiratory system. And it's comprised of heart, blood, vessels, and blood. Oh, hello. Heart, blood vessels, and blood. I was wondering why they put blood twice. I don't look at the commas. So the circulatory system again, it's basically uh, it's comprised of tubing, a pump, and the fluid that's within that tubing. In this picture, lets you know that the arteries have a thicker wall, while the veins have a thinner wall. But veins have valves, one-way valves, specifically in your legs themselves. Basic anatomy: you have the heart, atria, ventricles. You have the cardiac valves, tricuspid and bicuspid valve, pulmonic and aortic valve. Now, in essence, in essence, when we start talking, by defining it, you have 4 cavities. Okay, the atrias are the 2 uppers. And you have the ventricles, which are the lower. It's gonna put vent for ventricles. Atrias receive blood, and ventricles pump blood. Okay. So the ventricles will pump to the whole body, and the atrias are going to receive it from the body. Okay, in between this, you have valves. Of course, you have a valve right here, and you have another valve right here. And with the ventricles, push out blood while the atrias receive blood. The atrias will actually send blood to the ventricles, and the ventricles will then, like on the right side, will take it to the lungs, and the left side will take it to the aorta and the rest of the body. So we have cardiac valves. You have the tricuspid valve, bicuspid valve, one with 3 cups and one with 2 cups. And then you have the pulmonic and aortic valve. The pulmonic is the one that goes from the right side to the lungs, also known as pulmons in Spanish or Greek or whatever. And then you have the aortic valve, which goes straight to the aorta itself. And this is a better picture of it, but it's more confusing if you don't like anatomy. So you have the pulmonic valve right here, which takes it from the right side all the way to the lungs. And then you have your aortic valve, which is located right here. You can see it right next to the pulmonic valve, but it goes to the aorta and takes it to the rest of the body. And these are basically the tricuspid valve is on the right side and the bicuspid valve is on the left side. These are connected to the papillary muscles or the wall of the heart through chordia tendineae. And chordia tendineae is what makes the structures that actually kind of makes up the valves themselves, like a little parachute type of thing. Okay. The basic anatomy of the circulatory system: you have the arteries, aortic artery, coronary arteries, carotid arteries, femoral arteries, arteries of the arms and legs, or depending where they're at. And then right next to an artery is always going to be a vein. This here is your coronary circulation. And the coronary circulation deals with what the blood is going to feed, that's going to feed the heart itself. So this is your aorta. If you notice right here, let me see if I can. I'll draw it there. This is your aorta right there. Okay, and this is a picture of the outside. If you notice that right here, there are two little blood vessels that are coming out. So these blood vessels are after the valves. Okay, so let's run right here, one right here. And what happens is when the ventricle contracts, it pushes blood this way. But when it relaxes, the valves close, and this blood vessel has a recoil mechanism to where it's going to squeeze in and it pushes blood to your coronary circulation. Okay, so I know it's kind of funky, but it's interesting how some people get heart attacks. Basic anatomy, you have capillary beds. Capillary beds connect the arteriole to the venule, the side of gas exchange at the cellular level. Okay, you have basic anatomy, venous system, you have venules, veins, vena cava, and pulmonary veins. Go back. Yeah. And basically, and the same picture again, but in this case, we start dealing with how thick and how thin the capillaries are very thin. So oxygen and carbon dioxide can actually get through, while these are a little bit thicker. Okay. Vein, it's not that they're blue, but they're thinner. The wall is thinner, and they have one-way valves, specific to the ones in the legs. Now, when it comes to conduction, the electrical conduction of the heart itself, you have one thing that's called a sinoatrial node right here, or the SA node, and that one likes to fire at 60 to 100. You get down over here, you have the atrioventricular node, also known as the AV node, located right there. And there's like a slight delay from when it gets here for this to kick in and cause a contraction. So it starts up here at the bundle of hairs and starts going down. So because this part is electrified, this muscle kind of scoops up the heart inward. And then eventually the impulse goes around it, which basically scoops up and then squeezes, scoops up and squeezes, causing the blood to actually go out. Composition of blood, you have red blood cells, white blood cells, platelets, and plasma. Red blood cells are the ones that are going to be carrying all the oxygen, carbon dioxide, and certain nutrients. White blood cells are going to be fighting infections and everything else. Platelets are going to be fixing anything that might be wrong with the blood vessel. And the plasma itself can actually carry some carbon dioxide and oxygen and hormones and whatsoever. Physiology of circulation, assessing the pulse and blood pressure gives information about the adequacy of circulation. The pulse is created by a wave of blood propelled by the contraction of the left ventricle. So basically it's telling you once the left ventricle contracts, let's see, this is a blood vessel. If you have a ventricle contract, it's going to send like a ball of blood. And if you think about it, whenever you're checking for pulse and you put it there, it's like a little ball going through there, right? When you check for pulse. Well, that little ball is the outer edges. Let me see if I can erase part of it. Let me see if I can remember how to do it. Oh, there you go. Ah, damn it. So I'm not going to draw it. Let's see. So let's see, you have a ball of blood. According to the definition, the pressure that's being put against the blood vessel Oh, it's causing it to stretch out. That's your systolic blood pressure. Once it goes through, if it goes this way, whatever leaves the blood vessel open is your diastolic blood pressure. Now, you have to understand that blood pressure, let's say if we have like 120 over 80, which basically I think every single transported patient that's going back home or something has a blood pressure 120. I don't know how that happens. Every single one of them. So the 120 would be the pressure that's put against the blood vessels, and the 80s, whatever's left behind, keeping the blood vessels open. Okay, does that make sense, guys? That's blood pressure right there. The pulse is created by a pulse wave of blood propelled by the contraction of the left ventricle. Now, so when we start talking about the systolic and diastolic blood pressures, remember systolic is the top number. Whenever you get a systolic blood pressure, that's caused by the contraction of the ventricle, specifically the left ventricle. And the diastolic is a relaxation of the left ventricle.
Big one.
Get it? So the composition of blood is red blood cells, white blood cells, platelets, and plasma. Okay, remember, red blood cells will carry all the oxygen, carbon dioxide, and nutrients. White blood cells are the ones that are actually there to protect against infections whatsoever. Platelets are basically the ones that are going to be fixing up the walls of the blood vessels when they get cut or damaged. And plasma is going to be in there to actually carry some oxygen, carbon dioxide. Central pulses, what we look for is a carotid femoral. The carotid is up here on your neck, and the femoral is in between your legs. Of course, the peripheral pulses, you have radial, which is in your arms, brachial, which is in the bottom part of the arm where you check for kids' pulse, posterior tibial, and dorsalis pedis, which is both on the foot. Blood pressure is the force exerted on the walls of the arteries as blood actually passes through. As systolic blood pressure, and you have a diastolic blood pressure. Hydrostatic pressure is the force of fluid within the blood vessel and is determined by the volume of blood. You have elevated hydrostatic pressure can actually be detrimental. So you have too much fluid in there, fluid's going to seep out into the interstitial area. And that's because the pressure itself kind of pushes the water out, causing you to have swollen ankles or whatsoever. Now, the word perfusion is, by definition, is the amount of oxygen that gets from the outside of the environment to the inside of the lung to your tissues. Let's say your toe muscle. So perfusion will be considered normal. Hypoperfusion is when it's low. So in other words, you have lost some blood or some fluid somehow. Now, I know that if you lose blood, we know why your blood pressure drops. Now, what would cause another form of loss of blood pressure? What would be another cause of loss of blood pressure?
Shock.
The what?
Shock.
Well, shock is caused by a lot of different things, but be more specific. Think about it. If you sweat a lot and you run out of fluid or you're dehydrated, well, you're gonna have hypoperfusion because you have
I
enough
know.
liquid portion of the blood there.
I know the. Yeah, I guess like loss of fluids because every time we take like our patient's blood pressure after dialysis is always lower than normal.
Oh yeah, because they remove a lot of the crud that's in the blood, causing it to go down. That's why, I mean, that's how you guys make money. Because if the person was able to walk with a normal blood pressure out of dialysis, you won't be able to charge. So and dialysis does that. It keeps a lot of the stuff there, and because you have thicker blood, it's because it's got a lot of more elements in it. When you try to put it back in, well, the thickness of the blood is not by the fluid, is by the concentration of waste products and everything that's in there. So basically, there's two forms of where oxygen and carbon dioxide exchange. One of them is going to be in the lungs, and the other one is going to be in the tissues. And in this section right here, it's going to be in the brains. So this is what carbon dioxide and oxygen exchange in the tissues also, and of course in the lungs when you're getting it oxygenated and deoxygenated. Circulatory system is a transport of gases in the blood. 97% of oxygen is carried attached to hemoglobin, which is in the red blood cells. And 3% of the oxygen is dissolved in plasma. Okay, 3%, which is not, it's a lot, but I mean, it carries it too. It also carries carbon dioxide. 70% of carbon dioxide is carried in the plasma in the form of bicarbonate. And this is what basically bicarbonate is what kind of controls our pH in our body. 23% of carbon dioxide is attaches to hemoglobin, and 7% of carbon dioxide is dissolved in plasma. So,
But I thought we were slightly like our blood was slightly alkaline, not acidic.
we are slightly alkaline. You're right, because our body basically runs from 7.35 to 7.45. Now, when we start dealing with alkaline and base and alkaline and acidic, let me see if I can mix it again. We concentrate on the pH scale that tells us that 7.0 is normal. But we run at 7.35 to 7.45, which is a little bit further this way. So the further you go back over here, like to 0, you're going to be acidic. And if you go this other way, you're going to be alkaline. So we're slightly alkaline right here, 7.35 to 7.45. And you're right, we run a little bit alkaline. But so again, 70% is in bicarbonate, and bicarbonate is the thing that regulates our pH levels in our body. 23% of carbon dioxide is attached to hemoglobin, and 7% of carbon dioxide is dissolved in plasma. Now, what you have to remember, if a person is not breathing, they're not getting any oxygen in, and they're retaining a lot of hydronium ions, which is the OH, and that causes it to, or if you think about this, carbon dioxide equals acidity, and OHs deals with alkalinity or alkaline. If you retain too much CO2, your body's going to go acidic. So how do you fix that? Open up the airway. Give them oxygen. It's a real simple fix. So I mean, but some people don't believe in rules and they don't want to follow the rules. So the circulatory system, transport of gases in the blood, you have cell metabolism, aerobic metabolism, and anaerobic metabolism. Aerobic uses oxygen, anaerobic does not use oxygen. And we start dealing with these two, we start dealing with what we call something that we call a Krebs cycle. And when we're using oxygen as a metabolic substance to run our system, you're going to have ATP swarm. But when you don't have it, you're gonna start dealing with fat metabolism and all this other bad stuff. Well, not necessarily fat metabolism, but CO2 retention. Okay, functions of the nervous system. It controls and maintains a state of awareness. It transmits sensory stimuli to the brain. It controls voluntary and involuntary muscle functions. It controls body functions through an autonomic nervous system. Now, structural divisions of the nervous system. You have the central nervous system. It consists of the brain, spinal column, and the peripheral, which basically is everything else, your arms and legs. So this is part of your central nervous system. Again, the brain itself plus the spinal column, the spinal cord. We have the nervous system itself has neurons which basically sense stimuli and cause us to have a reaction. Functional divisions of the nervous system. You have the voluntary nervous system and the autonomic nervous system. Voluntary is whenever, let's say, you get mad at your girlfriend and you hold your breath. You're holding it in. That's voluntary. You're holding it in. The good thing is that the autonomic system kicks in and it will actually cause you to breathe. So we also have the sympathetic and the parasympathetic. The sympathetic is your fight or flight, and the parasympathetic is your feed and breathe. Consciousness and unconsciousness. This relies on the cerebral hemispheres and the reticular activating system, also known as RAS. The reticular activating system is a group of nerves in the brainstem and basically unconsciousness results in the reticular activating system or both cerebral hemispheres are not functioning properly. The endocrine system. The endocrine system itself is made up of ductless glands and secrete hormones to regulate body functions. And usually these are the ones that you start getting nervous. Your system starts to throw epinephrine, and epinephrine, that causes your system to go up. Your pulse goes up, and everything, but it's released in the blood, and it only activates the target cells that it's going to activate. Okay, so basically, the endocrine system consists of the pineal gland, the thyroid and parathyroid gland, the adrenal gland, gonads, which basically your ovaries and testes, islets or Langerhans, pituitary gland, and thymus gland. So right here, the pituitary is divided into the anterior and posterior. It is located right here in the middle of the brain, and it's encircled by the bottom portion of the what do you call it? The bottom portion of the skull, or the vascular skull, and the back portion releases a couple of hormones, while the anterior portion releases, I think, like 6 of the hormones. So the back portion controls certain things and it releases them to the blood. Sometimes it goes directly into the ducts itself, but it's usually floating around. You have your thyroid gland. You have also I'm sorry, I can barely read this because you're showing it very small. Oh, this is part of the immune system, your thymus gland. Now, as adults, we don't have a thymus gland, but we used to as kids, and they help us produce T cells in our immune system. And what's important and what's over is the suprarenal glands. At this point, this is the testes, and of course, the pancreas. The pancreas itself is one of the organs that does both. It's an endocrine gland and actually a digestive gland. Epinephrine and norepinephrine, also known as adrenaline and norepinephrine, are secreted by the adrenal glands, and the adrenal glands are right on top of the kidneys. Okay, they produce many of the signs and symptoms of a sympathetic nervous system stimulation. Excuse me. Okay. And then of course this type of system will release hormones, and these hormones are going to be acting on alpha 1 receptors, alpha 2 receptors, beta 1 receptors, and beta 3 receptors. And these actually have different functions. I don't remember we go over them, but the actually we don't. Integumentary system is the skin. And the integumentary system itself separates the body from the outside environment. It functions to protect the body. It regulates core temperature. It serves as receptors of external stimuli and aid in regulation of water and electrolytes. Basically, your skin, that's what it does. Layers of the skin, we have the epidermis, dermis, and subcutaneous. And the first top layer that you get to see is your epidermis. So if somebody tells you, hey, your epidermis is showing, they said, that's what I mean to do. The dermis is below that. You have blood vessels and some glands. Subcutaneous basically is lower. You notice this right here. Epidermis, you have the dermis itself and your subcutaneous layer. A digestive system consists of an alimentary tract and accessory organs, functions functions to ingest and allow absorption of nutrients and eliminate waste products. Structures of the digestive system. We have the stomach, pancreas, liver and gallbladder, spleen, small and large intestine, and rectum and anus. Okay, and these are the different organs. So you start with the mouth itself, and then the oral cavity. Then you have your esophagus, which connects to your stomach. You have your stomach itself. Then you have like the pancreas releases a couple of chemicals to break down proteins, and then your liver produces a chemical that's stored in the gallbladder, which causes it to secrete into the small intestine. Okay. The digestive system, there's two processes. You have mechanical digestion and chemical digestion. Mechanical digestion is going to happen in the mouth area when you chew food. There's also mechanical in the stomach because the stomach is lined up with 3 different layers of muscles. And all these are moving and churning around the food, which now we call it chyme, with digestive fluids, which is your hydrochloric acid in your stomach. Okay, the urinary system or renal system filters, excretes waste to maintain a balance of water and their substances. Main structures are the kidneys, ureters, urinary bladder, and urethra. So basically, are your kidneys right here, and then you have your urinary bladder. If you have, of course, you have your female and male, the way you actually excrete the urine out. A male, basically the male reproductive system, the male sperm and the female's ovum actually contribute to genes and determine the hereditary characteristics of an offspring. A fertilized ovum grows into an embryo, then into a fetus, and finally into a newborn baby. And basically, males produce sperm, females produce the ova, and when they both mix, you have the potentiality of actually developing another human being. Now, medical terminology is specialized language used in all fields of medicine. You have a complex words can actually be simplified with an understanding of combining forms, suffixes, and prefixes. Now here we have some, and the way you actually refer to some of these, I'm gonna go ahead and let you guys read them, but like cardio. Okay, cardio, the root word would be cardio or cardi. Combining vowel would be O. So you have cardiomegaly. Megaly would be your suffix. Questions? See if I can. Okay, I'll tell you what. What time is it right now? 8:23. I'll go. We'll go over the test. So bring the test to the library on Wednesday, and we'll go
Okay.
over them there. The other thing is also don't forget at 6 o'clock, because I'm gonna be there from maybe 5:30, because if you show up like 10 minutes late, they give it to somebody else. So, and not only that, by 9 o'clock we need to move out. So we need to cover these other two chapters and go over this. Any questions?
No, sir.
Okay. Well, then you guys have a good day and don't work too much tomorrow or work a lot tomorrow. And then go ahead and I'll meet you on in the library on Wednesday.
Yes,
Right?
sir.
Remember Lark.
I'll be there. Lark, yeah.
The one Lark is the one up north.
Okay.
Okay. Done.